All right, let's talk about it. If you're a nursing student, you know there's one word that just kind of hangs over everything, the NCLEX. It's the big one, right? That final hurdle between all your hard work and your actual career. And yeah, it's a huge source of stress. But we're going to flip that script, starting right now.
See, this isn't going to be just another boring study guide. I want you to think of this as your official mission briefing. We're going to take all that anxiety and we're going to swap it out for a clear, actionable plan that's going to walk you straight towards success. So here's our battle plan for today. First, we're going to define the mission itself. Then we'll decode the exam's official blueprint. After that, it's all about building your study arsenal, mastering some winning tactics, and finally executing that plan on the big day. Let's dive in.
Okay, first things first, the mission. You can't conquer something if you don't know exactly what you're up against. So let's define the target. Here's the most important thing you need to get about the NCLEX. It is not a test of everything you learned in nursing school. It's a very specific exam created by the NCSBN for one single purpose, to make sure you're going to be a safe, competent nurse at the entry level. It all comes down to safety and sound clinical judgment. That's it.
So every good mission needs intel, right? For us, the absolute best intel comes straight from the source, the official NCSBN test plan. You got to think of this as the literal map to the entire exam. It's like they're giving you the cheat codes. And boom, here's that map. This chart tells us exactly where to aim our efforts. Look at that huge slice, physiological integrity. That can be more than half of your exam. And tucked inside that massive category is a super important part called basic care and comfort. This is where they test you on those fundamental nursing skills. Stuff like knowing how to prevent pressure injuries, managing a patient's pain without just throwing drugs at them, or even handling nutrition through an NG tube. This chart is literally screaming at you where to spend most of your time.
Okay, we've got the map. Now it's time to gear up. There are a million study resources out there, and honestly, it can be overwhelming. The secret isn't to use all of them, but to choose the right tool for the right job.
So let's break it down. Your question bank, or Q bank, that's your daily training, your drills. But let's say you keep getting questions wrong on that basic care and comfort stuff we just talked about. Maybe it's questions on assistive devices or ostomy care. Well, that's your signal. You put down the Q bank and you pivot to a video lecture to really understand the concept visually. You use guides for a quick memory refresh, and you lean on online communities when you just need to know you're not alone. It's about being strategic.
But listen, at the end of the day, you can have the most expensive, fanciest Q bank in the world, but it's worthless if you never open it. The single best resource is the one you actually show up and use every single day. Find what clicks with your brain and commit to it. That consistency is your secret weapon.
All right, we've got our map, we've got our gear. Now it's time to talk tactics. These are the strategies that have been proven time and time again by the thousands of nurses who have walked this path and succeeded.
This right here, this is probably the most important mental shift you can make. The NCLEX doesn't really care if you can list 20 side effects of a drug from memory. What it cares about is if you can look at a patient scenario, spot a problem, and understand why one action is safer and better than all the others. It's a critical thinking test, plain and simple.
So let's turn that idea into 4 concrete actions. 1, make a study schedule you can actually stick to. 2, and this is the absolute key to the kingdom, you have to live inside the rationales. For every single question, you need to understand not just why the right answer is right, but why the wrong answers are deadly wrong. That's where the real learning happens. 3, mix up your resources to keep things fresh. And 4, you have to practice under real test conditions to build up your mental stamina. We're in the home stretch now. This is the final phase of the mission, execution. All of that preparation, all that practice, it all comes together in the final countdown to test day. Here's your timeline. A month out, you're deep in the trenches, hitting those weak spots, doing questions every day. A week out, you take one last full simulation exam to check your endurance, and then you ease up. You switch to light review. And now listen, this part's crucial. The day before the exam, you stop. I mean it. You do not cram. Your brain is a muscle and it needs to rest. Your training is done. On test day, your only job is to eat a good breakfast, show up, and trust the work you put in. So let's do a quick mission debrief. These are your 5 keys to victory. 1, use the test plan as your guide. 2, build a smart, diverse study arsenal. 3, obsess over the why and the rationales. 4, practice like it's the real deal. And 5, walk into that testing center knowing you've earned this. Be confident.
You have the intel, you have the strategy, you have the timeline. The mission is officially a go. So the only question left is, what's the very first step you're going to take? Right now, today. Is it downloading that test plan? Is it doing your first 10 practice questions? Your mission starts now. Go get 'em.